Hello friends, I'm Dr. Vidisha M Pradhan, your orthodontist. Today I'm here to discuss with you 8 signs that you need to look for which will tell you if your child needs an early orthodontic consultation. So before we dive into what are these 8 signs, let's first know why having straight teeth or well-aligned teeth is necessary. According to American Association of Orthodontics, you should get your child for his or her first orthodontic consultation when their permanent or adult teeth start to come out in the oral cavity, that is around 7 to 8 years of age. So there are around only 10 to 15% of the cases which would require a treatment immediately at the age of 7 to 8 years, but rest of the cases can be diagnosed early, and if a problem is going to develop, it can be prevented at this age itself. So whatever small problem that was present at the age of 7 to 8 years, it might develop into something very big at the adult age or around 16 to 18 years of age. To prevent such a small problem to develop into a larger problem, there is absolutely no harm to take an early consultation. Now, straight or well-aligned teeth are not only something that enhances or gives you a more beautiful smile, but there are also other aspects to it. Firstly, they help prevent difficulty in chewing, they help prevent difficulty in biting, they provide overall a better dental health. Also, straight teeth are easier to clean and brush. Next, let's dig into these 8 signs that you need to look for in your child. Number 1 is an anterior crossbite. So generally, this is how your upper teeth are supposed to overlap over your lower teeth. So when you look at it from the side and when you look at it from the front, your upper teeth will basically cover almost 2 to 3 millimeters of your lower teeth. But in cases of anterior crossbite, it is exactly the opposite. That is, your lower teeth, they lie ahead of your upper teeth. So what it does is basically it restricts the growth of the upper jaw. When corrected at an early age, they have a very good prognosis. Second one is posterior crossbite. As you can see in the picture, a posterior crossbite is something where your lower teeth again lie outside the upper teeth, but this time instead of the front teeth, it's the back teeth. That is, your upper back teeth will be constrained or will be restricted by the lower back teeth. That is a posterior crossbite, and again, when corrected early, they render very good results. The third one is habits like thumb sucking, finger sucking, or mouth breathing habits. Generally, by the age of 2 to 4 years maximum, your child should stop the habit of thumb sucking. If the habit of sucking continues beyond the age of 4 years and you as parents have tried every measure already, it's time to consult an orthodontist or a pedodontist for your child. Not only do we have measures to stop these habits of your child, we also have measures to prevent the dental problems that will happen if these habits continue to a more elder age. Also, the habit of mouth breathing, that is, if your child breathes through his mouth instead of the nose, there can be dental as well as ENT problems, so you should take your child for an early consultation. The fourth problem that we need to discuss is an anterior open bite. So, as we had already seen, this kind of an overlap is generally present between the upper and the lower teeth. If this overlap is missing and instead of the overlap, there is a gap that is present between the upper and the lower front teeth, this is called an anterior open bite. In an anterior open bite, your child will also have some space for the tongue to rest between his or her upper and lower teeth, and this is your indication for an ortho consultation. The fifth problem is severe retrognathia. Retro means backward, gnathia means jaw. So if the lower jaw is positioned very posterior or very backwards as compared to your upper jaw, this will lead to an appearance also known as buck teeth appearance. In a buck teeth appearance, generally it is very common for your child to land up in anterior trauma. That is, when he or she is playing in a playground and when they fall or when a ball hits them on the front teeth, these teeth will fracture and in the future lead to many problems. These are the front and side profiles of a child who has buck teeth. The sixth problem would be clicking of the jaws, asymmetry of the face, or shifting of the jaw while closing. Firstly, there are some chances of clicking of the temporomandibular joint, that is this joint, when your child closes the mouth. The second thing that you have to notice is facial symmetry. When you look at center of the forehead, this point in the nose and this point of the chin or center point of the chin, these three should lie in a straight line. If they lie in a straight line, we say that the face is symmetric. But if there is any kind of asymmetry present, that is if your chin deviates to the right or towards the left side, these can again be corrected before the growth of your child is completed. That is probably around the age of 13 to 14 years maximum. The seventh thing to look for is blocked teeth or teeth erupting in a wrong position. When we see milk teeth of the child, there should be some amount of space present between these milk teeth. If your child's milk teeth or temporary teeth are nicely placed just next to each other without any spaces present between these teeth, there's a good chance that the permanent or the adult teeth would erupt in improper positions. A blocked teeth in the lower jaw or the upper jaw can also lead to trauma to the tongue or cuts in the tongue. The eighth thing to look for is supernumerary or extra teeth. Now these extra teeth can be either permanent in nature, as you can see in this picture, or they can also be extra teeth present in the mouth because the milk teeth have failed to shed at the right time. So an appearance of too many teeth or numerous teeth can be seen in the mouth of your child. I will be discussing each and every topic in further detail as to what complications each problem might lead to if not treated at the correct time. In conclusion, I would say that early diagnosis is a key for better treatment results. Firstly, early diagnosis will lead to lesser treatment duration, that is less amount of time that the braces is present in your child's mouth. Secondly, a lot of early diagnosed cases will also prevent extraction during braces treatment in your child. So take a careful look at your child's mouth as he or she is growing up. Thank you.